Well, welcome back. It's estimated that 50 million Americans deal with the stress and worry of hair loss and thinning hair.
But in February, our next guest began a new non-invasive program as a trial. Dr. Deborah Mangione is back with the results. She's the owner of Wisconsin Vein Center and MediSpa. So excited to have you here.
Nice to be back.
And we're going to hold them. You got to wait to see the before and after.
I know. I know that Katie said she had to show a few, but still.
Yes.
It's really incredible.
Okay, so I'm excited to hear about it. So talk a little bit about what you did and where this has begun.
We had started doing some hair restoration projects and trials, not trials, but actual treatments, I would say probably 6 years ago, using PRP.
I remember.
And PRP does work for most people, but not enough to see a result for a lot of people.
Got it.
And we were seeing, for instance, about 70% of women really had a response, but only about 40% of men at the most. It had to be recent hair loss, which we understood. And that's painful treatment. It's injecting little injections of platelet rich plasma into the scalp after we've taken a blood sample from the person and spun it down and gotten their plasma. So that we weren't thrilled with that. And then we also tried another thing called Keralase, and that was using another serum that we put on the scalp and then lasered in. Not really as painful, pretty well tolerated. And again, we saw some results, but not exciting results.
Okay.
And not enough to really feel that we could tell people you should do this. It's really going to help. And so we were a little bit reluctant to start anything else.
Yeah.
This is so different, though.
It is.
Plant-based, derived.
Yes, that's right. Plant-based signaling factors. So it's almost like having exosomes telling growth factors or your stem cells to get going and get moving. Okay, and because that's what exosomes do. They signal other cells. And these are not human-based, so they're very safe. It's FDA approved.
Yep.
And so this is just a serum that we put on the scalp after the scalp's been cleansed, and then use ultrasound to get it to penetrate.
So no pain.
Like
Ultrasound doesn't hurt at all.
Like it's getting a scalp massage.
Yeah, like literally.
A little warm massage. That's about it.
Interesting. So, okay, so as you've done this, how long ago did you start this?
We started in February. We had a little event one night for anybody who's interested in learning more about it. And then we specifically limited it to people who were not already using Rogaine and not using things that could interfere with the study. We wanted to see if this worked. This specifically worked alone.
And how many treatments? What was the process that you did with people?
So the treatment is one treatment a month, every 4 weeks for the first 3. So by the time you have your third treatment, it's just been at 2 months. And then at 6 months from the time you started, you have one more treatment. In the meantime, you're using a twice-a-day take-home product.
Okay.
And that take-home product is just one small dropper full, 1 cc, that you massage into the areas where you have hair loss. Or if you don't have a lot of, you're just thinning, you massage it all over.
Yeah.
And it doesn't really make your hair look greasy or anything else. You just can put it on damp hair or dry hair.
Okay. And then with men and women?
With men and women, we had both in our little study group. We called it a study because we wanted to see if it worked in our center.
Yes.
You know, we were getting reports of this working everywhere, but we wanted to know if it worked on our patients.
And what are you finding?
We are finding kind of unbelievable results.
Really?
And we can show some pictures. Now it's early because we started in February.
Yeah.
This is only April.
Here they are.
We have seen people come back for a second treatment.
Oh, that's a lot.
A third treatment. And seeing really nice results.
Wow.
So as long as there are any little hair follicles in the region that we're treating, we are seeing people get results.
And how are you able to determine that? Because I assume you've got to really look at their hair follicles.
We do. We have to look, and we have a special hair camera also that we're using that will show a certain area repeatedly. You can go to that same area to look and see what the growth is like. But I mean, really seeing some nice growth, even in areas like with this person, she had alopecia areata, which is a really wide patch of no hair at all. And, people are thrilled. I mean, they've been hugging me when they see me. I'm not even doing the treatments, but they're saying, I can't believe
look
it.
at that.
I can't believe it.
That's a lot of hair growth.
It is.
And does it work when we're talking about like men too? Because men and women have different patterns. Does it work in any pattern? Does the male
look at that
pattern
one.
It definitely works in all the patterns. But with men with the thinning of the temples like you have, that's usually the first thing that people see. That's usually the first thing
they talk about it all the time.
That you experience as a man. That may be where it starts.
Sure.
And if that's more than about 5 years old, we don't know how well this will work. Because as I said, you need to have some live hair follicles.
So you're not bringing back
even if they're weak.
Your hairline from when you were 16.
No.
Right?
But we have young men in this trial too, who are in their 20s, who are little frantic that they're already losing hair.
I'm sure.
Oh, yeah.
And honestly, any amount of hair restoration, even if minimal, is noticeable to people and can fill in and be enough to change all that kind of confidence.
Yes, and women notice thinning all over.
Sure.
Yes.
And
that's more traumatizing than even men. Yes.
it is. And women are much more willing to do the at-home compliant, be
I
compliant
bet.
with doing treatments because they notice a result and they feel a result. Your hair feels thicker.
So when you're doing the treatment, say I'm just going to use women because I'm a woman. So when say they're seeing it along their part line, do you only treat that area, or are you treating the whole head?
We're not treating the whole head. We're
just
treating
that area.
But we will do the cleansing and the infiltration of the product in that area and all around it.
What about eyebrows? No, you're like, no, this is for the head.
We have not tried it.
It's called microblading.
Just checking. I know. I'm like, everybody wants the thicker eyebrows these days.
These results
That's
are
next.
really fantastic.
I only brought a few of the pictures. We had sets of 8 or 9 different people.
Wow.
And what the results were to show.
So can people come in then and meet with you and you'll look at their hairline? How does the process work to know?
They come in for a consultation, which are complimentary. These consultations are. And either one of our estheticians and then either one of a nurse practitioner, PA, or I meet with them as well.
Okay.
And we determine if they seem to be a good candidate for this.
Perfect.
Now, people can continue to use other products. After our first group that we just want to see, our first group, does this work? Now anybody can come in and they can continue doing whatever they're doing, and we'll add this in.
Perfect. Okay, so we're going to give all the information because if people have questions, they're probably going to.
This is really exciting.
It is. Thank you, doctor.
Thank you.
You're welcome.
Good to
Great
see you. All right, if you've got questions about hair loss or hair thinning, just contact the Wisconsin Vein Center and MediSpa. They're located in Pewaukee. Their phone number is 262-746-9088. Or for more information, visit their website online at wimedispa.com. And look at those results. Incredible.